The main issue with vitamin D toxicity, known as hypervitaminosis D, is that it triggers hypercalcemia, too much calcium circulating in the bloodstream. You may be thinking, well, calcium is good, right? And it is, until it starts showing up where it doesn't belong. High blood calcium can lead to symptoms like nausea, vomiting, excessive thirst, frequent urination, constipation, muscle weakness, and confusion. If you're lucky, your body gives you some of these clues early. If not, you might skip the warning signs and head straight into more serious outcomes, like kidney stones, calcification of soft tissues, including arteries and heart valves, or progressive kidney damage. In extreme cases, often from megadoses well beyond the recommended daily allowance, vitamin D toxicity can lead to arrhythmias, calcification of the coronary arteries, and irreversible damage to the kidneys or heart. And here's the kicker. These side effects might not appear until weeks or months after you've started the overdose. It's not the kind of thing you notice with a single extra capsule, but the kind of creeping issue that builds quietly and then crashes the party, wearing a lab coat. Complicating matters is the fact that many people start vitamin D supplements based on vague symptoms, fatigue, low mood, achy bones, without testing their levels first. Or worse, they self-treat based on something a wellness influencer said on a podcast involving ancestral sunlight and shadow detox. Unfortunately, your vitamin D needs are as individual as your skin tone, geographic location, sun exposure habits, and metabolic health. What's too little for one person could be way too much for someone else. And while some integrative doctors recommend higher doses, often in the 2,000 to 5,000 IU range daily, these should ideally be tailored to your blood work, not a one-size-fits-all guess. The official safe upper limit, according to most health authorities, is 4,000 IU per day for adults, though toxic effects are typically seen at sustained intakes above 10,000 IU. That said, a few weeks of overenthusiastic megadosing can be enough to push some people into dangerous territory, particularly if they also take calcium supplements or have underlying kidney issues. The irony here is rich. The vitamin that helps you absorb calcium more effectively can become the very thing that floods your body with calcium until it breaks down. It's like hiring a great housekeeper and then realizing they've started gluing furniture to the ceiling because they felt it made sense at the time. So, what's the takeaway? Vitamin D is vital, but it's also a hormone-like compound with systemic effects that demand respect. If you're feeling run down, moody, or brittle-boned, it's worth getting your levels checked before throwing back capsules like candy. If you do supplement, aim for moderation and periodic blood tests to make sure you're in the Goldilocks zone. Not too low, not too high, just enough to keep your bones, brain, and immune system humming. And if you find yourself tempted to double your dose just because the bottle says immune support, take a breath. Then take a walk outside. Sunshine remains the most natural source of vitamin D we have. No kidney stones required.